So iron deficiency is, I think, the one of the biggest misconception is its correlation to anemia. Like both practitioners and patients, relating it to the lack or presence or absence of anemia. And we know that iron deficiency can happen even in the absence of overt anemia in these patients, and especially in the heart failure population. And so that leads on to a lot of misconception, confusion, and also a lot of times, lack of overt bleeding or overt end-stage kidney disease or chronic kidney disease. In absence of those comorbidities, a lot of practitioners feel like maybe they don't suspect iron deficiency as being present in this population, and then the lack of awareness about correlation with symptoms, and especially in patients who are already on good medical therapy and still have symptomatic ambulatory heart failure or even decompensated heart failure admitted to the hospital. They may not be aware of the definitions of or more contemporary definition of iron deficiency in heart failure. So there's a plenty of data now that we know, both epidemiological from clinical trials, both small scale as well as larger studies, that iron deficiency in heart failure is correlated with a lot of different endpoints, starting from endurance or limited endurance, also poor functional class, quality of life. We know the iron deficiency in heart failure is related to risk for repeat hospitalization in heart failure population, and then its relation to overall mortality, both cardiovascular death and total mortality in this population. So there is now, pretty good evidence to suggest that correlation or relationship between iron deficiency and these patient-centered outcomes.